Okay, hi, I'm Abby Phelps, and this is my second video. And in this video, we will be going over hypovolemic shock. Right, so what is hypovolemic shock? So it is loss of intravascular volume in the cardiovascular system, which can equal to hypoperfusion of organs and tissues, caused by blood loss or fluid loss related to certain chronic conditions or therapies. All right, so some signs and symptoms that you would find with your patient that has hypovolemic shock. Um, they'll they'll have weakness, lightheadedness, confusion, trauma, vomiting, diarrhea, sweating. They typically will have cool, clammy skin, low temperature, a low blood pressure, and an increased heart rate. And typically, their heart rate increases with most of the shocks that we will be going through. All right, so imaging for suspected hypovolemic shock. Um, so a traumatic patient with hypovolemic shock usually requires ultrasound examination in the emergency department if an abdominal aortic aneurysm is suspected, or an AAA. An upright chest radiograph should be obtained if a purported ulcer or syndrome is a possibility. And scopy, excuse me, endoscopy can be performed usually after the patient has been admitted to further determine the source of bleeding. So they'll put long scope into your body with a camera at the end of it to figure out where the source of bleeding is. If the patient is pregnant and in shock, surgical consultation and consideration of bedside pelvic a pelvic ultrasound should be immediately performed in the emergency department. If thoracic dissection is suspected because of the mechanism and initial chest radiograph findings, the workup may include a transesophageal ECG, and aortography or CT scanning of the chest. If a traumatic abdominal injury is suspected, a focused abdominal sonography for trauma. Ultrasound examination may be performed in the stable or unstable patient. A CT scan is typically performed in a stable patient, and if long bone fractures are suspected, radiographs should be obtained. And I will show you a picture of a long bone fracture. So here's an image that I found, and a lot of hypovolemic shocks can be from a long bone fracture. So in this is an 18-year-old male presented to emergency department with an alleged history of road traffic accident and unconscious and hemodynamically unstable state with a Glasgow Coma scale of 3. Primary survey revealed traumatic brain injury, blunt trauma to the abdomen with soft tissue and bone injuries. And this image right here revealed compound fracture of the right distal femur. Right, so hemodynamic monitoring and values. So patient's APV, which gives continuous blood pressure readings and includes the patient's map. So their blood pressure will typically read low, and so will your patient's map for hypovolemic shock. And typically it'll be less than 60 millimeters of mercury. Your CVP, which reflects your right atrial pressure and preload, will typically be low. Your PAP and your pulmonary capillary wedge pressure are typically low as well. It is not as common to see this due to how the Swan Gaines catheter is not as typically used anymore. But your cardiac output and stroke volume is typically as low as well and is measured using thermodilution or other techniques. And also an increased heart rate, which is typically measured with the EKG. It typically increases in hypovolemic shock because the body tries to compensate for that reduced blood volume. So medications for hypovolemic shock that they typically use are vasopressors. Well, vasopressors are not typically recommended unless profound hypotension unresponsive to the fluid infusion is present. Vasopressors, in the absence of adequate resuscitation, tend to further reduce tissue perfusion since they do not correct the primary problem. And also, they use replacement fluid, different kinds of solutions, and blood products such as packed red blood cells and plasma are popular for hypovolemic shock. So, an ABG for hypovolemic shock will be metabolic acidosis, which will usually show as low pH. Your patient may have a low bicarb. Their PaCO2 can be low due to respiratory compensation or high due to respiratory failure. PaO2 can vary depending on the patient's respiratory status, so it can really vary from patient to patient. So, mechanical ventilation settings for your patient in hypovolemic shock. Typically, for your patient, you want lowest possible mean airway pressure by setting a low tidal volume. So, 6 to 8 mLs per kilo of ideal body weight, is typical for your patient. They like to use minimal PEEP because if your PEEP is set too high, it can increase your vasoconstriction and affect hypotension and decrease your venous return. Excessive positive pressure ventilation can worsen the shock state by reducing venous return to the heart. And for your rate, it really depends on your patient's ABG. So you just adjust it appropriately to maintain an adequate PaCO2, which is between 35 and 45. Specific concerns in positive pressure ventilation. So concerns that can happen to a patient in hypovolemic shock. There's 3 main ones that I wanted to go through. So first one is kidney damage, which is common with a lot of the other shocks as well. But it may require permanent or temporary dialysis treatment due to the inadequate blood flow to the kidneys due to the low blood volume. And then brain damage, also due to the inadequate blood flow, and especially to your brain, it can cause irreversible brain damage. Heart and lung damage due to the inadequate blood supply. It can lead to impaired oxygen delivery to the lungs and decrease cardiac output. Also, in the settings of hypovolemic shock, positive pressure ventilation may diminish venous return, and diminish cardiac outcome and worsen the shock state. So that's why typically they will use the low PEEP and the low tidal volumes. While oxygenation and ventilation are necessary, excessive positive pressure ventilation can be detrimental for a patient suffering with hypovolemic shock. So summary. So we went over the physical exam findings, what your patient would look like in hypovolemic shock, imaging. So chest x-rays, CT scans, ultrasounds are the three main ones. Hemodynamics and monitoring, medications to help increase the blood pressure due to hypovolemic shock decreases your blood pressure. We went over ABGs, vent settings that need to be lower, and specific concerns, which can be multiple organs declining, and how positive pressure ventilation, how you have to be careful with your vent settings. So hypovolemic shock is a severe form of hypovolemia that needs emergent treatment. This condition occurs when you lose a significant amount of fluid or blood, which prevents your heart from pumping blood throughout your body. Hypovolemic shock can cause your organs to stop functioning. All right.